Hello, warm greetings from MVR CanCon 2024. I'm Dr. John Alapatt, surgical oncologist working in MVR Cancer Center. Today, we have a very eminent personality in the field of cancer epidemiology. We have none other than Dr. Prashant Mathur, who is the director of the Indian Council of Medical Research and National Center of Disease Informatics. A warm welcome to you, sir. So we would like to ask you a set of questions to explain to the general public more about what ICMR is all about and more about our cancer registry and the work which is being done by ICMR. So how does the Indian Council of Medical Research utilize our cancer data to formulate a policy or a clinical guidelines? Or is it in the process, or are we doing something for creating a clinical guideline?
Thank you very much for that very important question because ICMR set up the National Cancer Registry program way back in 1981. And it is now 43 years that we are very vibrantly running the cancer registry network across the country. And one of the very important functions which the registry network does is to collect data on occurrence of cancer, the regional variations in cancer, the different types and sites of cancer, and provides very reliable evidence for policy making and government's action at the central as well as at the state level. It is the only data set which guides cancer control program on a large scale. And yes, it has contributed a lot. So we know now that the Ministry of Health has initiated screening for breast, cervix, and oral cancer. And the rationale and justification came from the cancer registry. Because the registry showed that these are the three topmost cancers in India, which causes the highest sufferings as well as deaths in cancer. And also that these three cancers are amenable to be screened at a population level. So giving that input is also important. The second major area of contribution which the registry makes is it makes a lot of stakeholders, including government and non-government actors, whether it is pharma industry, whether it is other stakeholders who are involved in cancer prevention and control, with the evidence to act upon. And it is a useful tool to create that advocacy to invest in cancer care. If you look at the tobacco story, the smoking tobacco, all over the pictures which are shown are of cancer. So, cancer as an outcome of tobacco smoking is a very huge achievement for the registry to show at an advocacy level. And similarly, there are many contributions also towards improving clinical care through guideline development. Uh, Basic function of a registry and cancer epidemiology is to guide action through evidence, through data. Because one is to create the evidence, then to create the action, but equally important is to monitor the effect of that action. So, whatever is being done, whether it is making a meaningful impact as it was intended, is very reliably measured through the registry.
Thank you, sir. So, what are the major projects which ICMR has for India, our nation, and in terms of its cancer registry, and what are the main challenges faced by ICMR in data collection?
So, as I said, that cancer registries was started 43 years ago, and this network has been expanding over the years. More and more hospitals, both in the private sector and public sector, are joining the network to produce this evidence because now people are realizing that without data, you cannot know where are you acting upon and what are you acting upon. So, we are not only measuring the incidence and burden and mortality due to cancers, we are also contributing to care of cancer. So we are now able to measure reliably the kind of treatments which are given to patient, their effectiveness, and the biggest effectiveness tool is survival. So we have huge programs running to measure survival of cancers. And this indicates, if our survival rates are poor, it reflects on a lot of things, including delayed seeking of care by the patients. So most patients in India are diagnosed at advanced stages of cancer. And when you're diagnosed at advanced stages, your treatment becomes complicated, it becomes expensive, and yet the desired results are not seen. The other thing which we are able to measure is the kind of treatment algorithms which hospitals follow, and also the general health system of the country. How is it performing in detection of cancer at early stages? So, doing survival studies is an equally important role besides the routine cancer epidemiology.
So, thank you, sir, for this insightful talk. Although brief, it shed a lot of light on how the ICMR works and how real world data can change our policy in both screening, treatment, and further prevention of cancers. Thank you, sir.
Thank you very much.